Hi everyone, my name is Ahmad and I'm a fourth-year medical student here at the University of Michigan. I'm also a member of the Health Policy and Economics Path of Excellence. I joined the path because I wanted to understand the framework of our healthcare system both in the US and internationally, and to learn about the multiple roles that we as future physicians have in directing and implementing policy change. As physicians in training, we have an important duty of providing great clinical care to our patients, but just as importantly, we have an obligation to be advocates for them as well, since there are facets of obstacles, whether that's the impact of insurance coverage on receiving proper care, to the impact that accessibility and transportation plays in patients' quality of life that can't be solved in the clinical setting alone. I also joined the path because it allows for great collaboration with faculty from all over the university, whether that's the School of Public Health to the law school. I think the path is a great opportunity, whether you're a health policy expert or a beginner, to dive into important conversations that'll have dramatic impact both on your work and your patient's care. So some of the benefits I've gained from joining the Path of Excellence include creating new mentor-mentee relationships within the School of Public Health, the law school, and the medical school, and getting involved with national work, for example, assessing the impact of COVID-19 on our nation's healthcare spending. I've also formed great friendships within our class, within the path, and have worked with many of them on educating our peers on core concepts of healthcare decision making. One of the great things about the path is meeting community, state, and national leaders in both policy and government through our monthly health policy seminars. For example, we had a seminar with the executive of the Washington County Health Department, and through our conversations, we learned of opportunities to get involved, and myself and some of my classmates serve as advisors for medical students. If you're looking for a great path of excellence that's easily integratable within the medical school and has great reach for you both professionally and personally, definitely consider joining this rewarding path. So a lot of my work is around improving care for cystic fibrosis patients, both clinically and legislatively. Through the Path of Excellence, I've been connected to organizations such as the Cystic Fibrosis Foundation and the Clinton Foundation, and have worked on creating a capstone for impact project, which involves the first global CF patient registry for patients in low and middle income countries. By creating a global registry, physicians and researchers have a better understanding of the need for equitable distribution for medication, and our aim is to advance both the quality of life and the life expectancy of patients across the globe.